Hi, my name is Aaliyah Parker and I will be doing an abdominal assessment today. And this is Mr. Anthony Parker. I'm going to ask for his permission to do his abdominal assessment today. Would that be okay?
Yes.
Okay. I'm also going to ask him if there's any areas in his abdomen that feel tender or painful. Is there?
No.
Okay. I will also ask him to go ahead and empty his bladder completely before we start this. We're going to assume that he did. And then I'm going to ask him to lay supine, which will be on your back, with his arms at his side. Go ahead. Once he's in that position, I will go ahead and put a pillow under his head for comfort. And for the reasons for the video, we will be adjusting the camera for a better angle of the abdominal assessment. So, we're going to first off take a look at his abdomen and look for any discoloration or rashes or irregularities to see if he has any of that, any angiomas, lesion. We're going to take note of any kind of distension and also the characteristics of the umbilicus. We're going to auscultate all four quadrants of the bowels, and then we're going to move to the aortic artery, iliac artery, femoral artery, and his renal arteries. So I'll listen now. First, I'm listening to all four quadrants of his bowels, making sure that they are active. And then I'm going to listen to his aortic artery first, and that's going to be right above the umbilicus at the costal margin of the ribs. And then I will slightly move down into the right for his iliac artery, his renal artery. And then move across for the other renal artery. Move slightly down for his iliac artery, across for the other side, and then slightly down for his femoral artery, and then across for the other side. Now that I have identified a tympani in all of those areas, I'm going to percuss his liver, and that I'm going to start at the midclavicular line, and I'm going to be moving downwards, starting right above his nipple. I'm going to be listening for resonance over the lungs, and then dullness when we reach the liver area. And then you hear the tympani when we're back over the intestines and the stomach area. Now I'm going to move to his spleen, checking for dullness because it's an organ. I'm going to go to the left of him in between the 6th and 10th rib. I'm going to percuss there, and you hear the dullness. Now I'm going to do light to moderate to deep palpation in all four quadrants, and I'm going to ask him to stop me if he feels any kind of tenderness or pain. So first of all, some light palpation with my fingertips. Are you feeling any tenderness or pain?
No.
And then I'm going to push more moderately. Any tenderness or pain?
No.
And then I'm going to go ahead and be pushing deep. Noting again any tenderness or pain. Okay, good. Did you have any tenderness or pain with that?
No.
All right, now I'm going to check his aortic pulsation. And before I palpate, I want to go to right above the umbilicus and with my fingers determine the size of the aorta. Anything greater than 3 centimeters, we will not palpate for the risk of rupturing a possible aneurysm. So he's good, so I can go ahead and palpate. And I'm going to be feeling for any strong pulsatile masses. for which I feel none, so that's good. Now I'm going to be looking for our Murphy sign, and that can tell us if we have possible cholecystitis, hepatitis, or maybe even hepatomegaly. To do this, I'm going to go to the right lower costal area, and then I'm going to palpate deeply. Any pain or tenderness?
No.
Okay, good. So that's negative. And then I'm going to palpate for our McBurney sign. And for this, I'm going to go to the umbilicus and then go to the lower right region. And I'm going to palpate deeply. This will be checking for possible appendicitis. Do you have any pain or tenderness?
No.
Great. So the last thing that I want to check is his costovertebral ankle. And for that, I'm going to have him sit up and readjust my camera. Can you go ahead and sit up and we're going to readjust the camera? Actually, if you move to the left, I think the camera will be able to pick it up. Perfect. So I'm going to find this angle by going to the 12th rib, and we're going to count down. And there we are. And then we're just going to feel on the left and the right of the sternum. So first we're going to just gently palpate. Oh, I'm sorry, I think I said the sternum. I meant his spine. So we're going to just gently palpate and ask, do you feel any pain or tenderness?
No.
Which he does not. So now we can go ahead and percuss with a closed fist. Did you feel any pain with that?
No.
All right, so that is negative, and that's good. That tells us that there's probably not any pyelonephritis or any signs of abscess. And that is all for my abdominal assessment.